Hey everybody, this is Jordan Smith. I'm up at the office here at Breathe Modern Dentistry, and I want to take 2 minutes to try to answer 3 quick questions about something that we do a lot of here, and that's dental implants. The first question is, what is a dental implant? The second question is, how long does it take to get a dental implant and restore that implant? And then 3, what's it feel like and does it hurt? So first question, I want to take you to this graphic, and it shows you the 3 components. First is the crown. That's the part that you chew and you smile with. The second part is the abutment, and that is basically a middle connector that holds the crown to the implant, and the implant itself is actually a simulated tooth root made of FDA grade medical titanium that goes within the maxilla or the mandible to replace a missing tooth. So that is actually what we usually lump into the term dental implant. It consists of 3 components, and I want to tell you about the next thing, and that is how long it takes to get a dental implant. So when we take out a tooth, which is what we often do here, and put an implant directly in its spot, we will normally have 3 months to wait for that dental implant to heal within the bone. After 3 months, we can begin the process of putting a tooth back on top, and that takes about 2 to 3 weeks to often have that finished. If a person walks in and a space is there and a tooth's been missing for a while, the same time frame occurs. We actually put the implant in, and we would wait 3 months. We would begin that restoration process, and by month 4, we typically have that tooth above the implant. Patients are often asking, how long does the procedure actually last? So when we take a tooth out, or we're going into a spot where a tooth's already been missing, that procedure only usually takes about 30 to 45 minutes, and we will be finished. That third question that patients often ask is, does that implant hurt? So when we take a tooth out and we put an implant directly in its spot, the patient knows no difference about whether or not there's an implant there or it's not there. The healing process is exactly the same, and we normally are going to cover that implant up, allow the tissue to heal over the top of it so it disappears during that 3 months that we're waiting. If a patient is missing a tooth and we're putting an implant into that missing space, normally it's more comfortable than having a tooth out. The procedure only, again, lasts about 30 to 45 minutes, and then in 3 or 4 months we will have that tooth back onto the implant so the patient can chew and smile with it well. So that's a 2-minute challenge. I hope that answered some of your questions. If you have further questions, give us a shout. We'll be happy to answer those, as well as do a free consultation to make sure that we look and give you all your options on dental implants. Hope you guys have a great weekend. Thanks for watching, and as always, I appreciate it.